orthopedist Timothy Kremchek, team surgeon of the Cincinnati Reds. Dr. Kremchek has more than 1,500 Tommy John procedures behind him and a growing sense of an epidemic spiraling out of control.
I have people that call here on a daily basis to schedule their son's Tommy John surgery. They want to come down, be seen, and have the Tommy John surgery the next day, not knowing if they really even need it, not really interested in talking about rehabbing. I see a kid the other day who came down and has a small partial tear. I want to rehab him. And his parents called me and said, just go ahead and do the operation. We want him to be better than he was. We don't want to wait, just go ahead and do it.
Every summer at the Little League World Series, tens of thousands of fans and an international TV audience cheer on young boys coping with major league expectations.
When I can sit here and tell you and list the top 20 baseball players in the 6th and 7th grade in the country, we got a problem. The competition to excel at a high level are driven oftentimes by the parents, which are driven by the coaches and the teams and the leagues, and they're pushing these kids. I think the epidemic is starting because we're abusing these kids at a young age. When you start taking 12-year-olds and put them on a national stage and national television, they're going to start throwing breaking balls all the time to get kids out to go to that next level. Now we're starting to find out that this abuse at a young age catches up with these kids 4 and 5 years later.
Dominance at age 12 is a poor predictor of success at age 25. Most Little League stars never play before a crowd of thousands again.
Number 11, Yen Pan.
I will challenge you, how many Little League World Series kids are in the big leagues? Not very many. And how many pitchers are in the big leagues? Not very many. I've been doing this for 21 years, 18 years at the major league level. It's become such a common procedure now, and I think the success rate of it is very high, but I think there's a lot of people that are very ignorant about what it really does, what it really means, and who should really have it. So show me exactly where it hurts you.
More like right down here.
But when I push right here,
yeah.
Is that what hurts?
Yeah.
You've torn the ligament in your elbow. We call it the UCL. Could be what you might know it as the Tommy John. What we do is we take the tendon from your forearm, if you've got one, and we actually transplant it onto the inside part of your elbow. You have to explain to them that it's not just slam dunk, boom, you know, this operation, and I'll be pitching in 9 months, don't worry about it. You have to make them understand there's a chance that won't happen. A lot of people think it's a panacea. They think all of a sudden I'm gonna get the surgery and be Superman. You're gonna make yourself Superman. I don't make you Superman. I can fix this, I can put this in there, but it's gonna be up to you to get to that next level. You know, people ask me all the time, I say, you take care of all these multi-million-dollar players on a day-to-day basis. You know, is that a lot of pressure? The answer is yeah, but not as much as these youngsters who, if you don't fix them and get them right where they can play their sport and do their thing, what happens to them? Do they not go to college? Do they hang out with the wrong crowd? You know, which way do they end up going? There's a lot of pressure there, too. We let them start throwing 4 months post-op. They get off the mound about 6 months post-op, but they're really not competing in games until at least 9 months, and depending on their level, might be 10 or 11. These kids usually don't have a significant amount of pain, and so they think they can do more than they probably should at 4, 5, 6, 7, 8 weeks post-op, and that's very difficult, holding them back. It drives me crazy when I see physicians, and I've seen it, oh, we made you better. We made you better than what? That's wrong. We are trying to replicate the best we can, take a tendon and turn it into a ligament in the inside portion of the elbow. We don't even come close to making this a native ligament. If you avoid an operation, you've got a longer and better chance of long-term success than if you have the operation. Convincing the parents and the kids and the coaches and the whole peer group around him can sometimes be very difficult, which leads to a lot of phone calls. I think it's hilarious, but I spend more time convincing people not to have surgery than I do to have surgery. As an orthopedic surgeon, I'm not going to cure cancer, but we do have a message. I think we do have a duty as physicians to educate the public, and I've been on that crusade for the last 10 years. In this area, the umpires call it the Kremchek rule. how many pitches these kids can throw, when they can start throwing breaking balls. So by educating little by little and educating the coaches and educating the parents and making them realize that their children's dreams can come true if they do some of these things, and you just have to stand on that platform. You can't do this at this level for the injuries and the medicine. You can't. You have to do it for a passion and a love of the game. I love baseball. I love the players. I love the fans, the smell of the stadium, the cigar smoke, the popcorn. I love it all. And for me to help in just a small little way, it's not a job. It's a way of life. It's a passion. I love it. Baseball is the game.